So welcome to the session on planning, recovery and renewal strategies. We've been working a lot with a range of different organisations over the last few months, learning about what they've been doing. And over the course of the next hour, we're going to share with you some thoughts that we've had about how you can develop strategies for recovery, strategies for renewal, and really try and take you on the journey that we've been through to think about how can you develop these strategies moving forward. My name's Duncan Shaw. I work at the University of Manchester. I'm Professor in Alliance Manchester Business School, and I work in the Humanitarian and Conflict Response Institute. David, do you want to introduce yourself, please?
Yeah, hi everybody. Delighted to be with you. Thank you for listening in. I also work with Duncan at the University of Manchester, and in this context, I guess I bring a little bit of experience and knowledge about recovery planning within UK resilience, having been a head of emergency planning and business continuity for a county council. So really looking forward to sharing our thoughts with you. I hope you enjoy it. I hope you find it useful.
Well, just to echo David's welcome, we thought we would start by introducing ourselves a little bit more and what we've been doing during COVID. So we've been doing a lot of work in the UK, both work on the response and then on the recovery. We've been working across 3 LRFs in the main, supporting and listening in to SCGs that they've been running, TCGs and cells, and now beginning to move into RCGs. And we've a particular interest in the voluntary sector and the sorts of work that have been going on around shielded and vulnerable people, but very much looking across the piece at all the activities that have been going on during COVID. We've been supporting national efforts and so been getting a national understanding as to what's happening. We've been working internationally, and so again around response and recovery, bringing lessons from across the world as well as affecting what other people are doing. So taking lessons into our partnering organisation, the Global Resilient Cities Network, and sharing with them some of the experiences that we've been having in the UK. We've been interviewing experts, we've been conducting and participating in webinars, and all of this work has been getting captured in the Manchester briefing. So this briefing is a document that brings together lessons from across the world. It's freely available. You can sign up, as you can see on your screen. And it's a place where we're sharing a lot of lessons that you might want to consider when thinking about recovery and renewal. So enough about that. Let's move on to what kind of thinking have we been doing at the university around recovery and renewal. The aim of this session is to help you to start thinking about some of the structures that you've been experiencing around recovery and thinking about what that might mean for renewal. We're going to talk about recovery management, but we're going to align it very closely with the guidance that comes out of Cabinet Office around recovery. We're going to be looking at the Recovery Coordinating Group, looking at its structure, participation, looking at its role within the recovery efforts and how that role can be fulfilled. We'll be looking at impact assessments and leading through into the development of recovery strategies and introducing the idea of a renewal summit. So taking you through this journey of what is recovery and what that means for the renewal of our cities, our country, or indeed wider afield.
So what we'll do then is we'll discuss it in 5 sections. So we're going to introduce you to the very basics of recovery. We're then going to walk you through how we believe you should set up a recovery coordination group and go into a little bit more detail about membership and some of the structural issues for local authorities in particular. We've got a good section on assessing the impacts of COVID and indeed any event requiring a prolonged and coordinated recovery. We're going to introduce you to how you might set up and establish, develop recovery strategies, some strategic objectives for common shared outcomes. And then we're going to take you back through a very brief recap to make sure that we've covered every issue we felt that was going to be important. So the legal basis for resilience planning in the UK is the Civil Contingencies Act of 2004. It sets out by statute the requirements for managing both response and recovery. It also establishes clear roles, responsibilities, statutory functions and duties under the Act for responder organisations. and it presents a very clear framework for how you would manage, prepare for, respond and recover from emergencies in the UK. Underpinning that legal basis are some non-statutory guidance documents. The most important ones, I think, for today's session is the National Recovery Guidance for local responders, and its supporting documents for very, very good documents around common issues. So, for example, how to complete impact assessments, and then also some guidance on humanitarian aspects, infrastructure, environment, and dealing with economic issues that will normally fall out of most emergency events that will require a prolonged or coordinated recovery. There is also now part of the set of standards, a resilience standard for local recovery management is the standard number 13. That also advises LRS how they might assure recovery capabilities at local level, their readiness, and indeed help them guide them through how to make continuous improvements as a resilience partnership. Underpinning all of that again is the recovery plan template, which for local planners, a useful document that sets out what should be in recovery plans, how to prepare to get partners together in the same room to start to decide what the recovery plan should look like, and in particular, some good guidance on how to form a strategy, the structures that are necessary for recovery, how to coordinate partners across the piece, and then how to activate the actual recovery process, handover from response, and then how to deal with the impacts of the event that we're dealing with. And of course, in this context, we're very much talking about COVID as a pandemic challenge. So why is recovery from COVID different to the other crises we've experienced in the UK? I think most people will agree, certainly in the early weeks, the pure scale and the pace of the response was purely breathtaking. This is an event that truly has reached down into all aspects of life at national level in a way that no other event has done. Even if you think about the wide area prolonged emergencies that are severe weather related, as intense as they are, they've never engaged the national response in a way that COVID has done. The impacts remain unclear. Indeed, we are beginning to understand a little bit more about emerging or the previously hidden effects and impacts on communities, individuals, the economy, the infrastructure, the environment. But the truth is we're still learning as the weeks progress. And of course, this is all happening at the same time as the ongoing change, the kind of fatigue issues that are 14, 15 weeks into what's been a most intense response period, certainly for certain aspects of the responding community. And of course, we all know that Brexit is still an ongoing concurrent issue, which will still need to be managed. So we think that's just some of the reasons. The rest of them you can see for yourselves on the screen. That's just some of the reasons why we think this recovery is so different from other crises recently experienced in the UK. Okay, so let's talk a little bit about what we found out about the recovery priorities as we learn to live with COVID-19. And again, I'm going to allow your eyes a little bit of time to scan across the boxes on the screen, but it's not by any means an exhaustive list, but there's some suggestions here about some of the priorities that have been clear to us, certainly. Obviously, there's this, I think, very real worry about how to deal with concurrent events. And indeed, as we move between kind of response and recovery, maybe back into response, as we get more localized outbreaks. So you'll all be aware of outbreak control plans. We are worrying and preparing for a second wave, of course. We're beginning to see, China and the kind of Asian countries experiencing a little bit of second wave outbreak, and continuing to deal, of course, with all the logistical challenges around things like PPE. But some of the priorities will be more obvious to you. So restoring statutory functions at the earliest possibility is clearly going to be key. Providing safe public health and social care as we start to deal with more people affected within the community and away from the hospital settings, and of course, in particular, care homes. Smarter shielding as that operation begins, I guess, to work towards the end of that. But what will it mean beyond the release of shielding? What will be the issues that will need to be picked up? The COVID secure standards around how to be safe within public places and infrastructure, transport, for example. We've already talked about hidden, unmet and emerging needs that are becoming clearer to us. you know, we can all imagine the trauma experienced by some of our carers, our care staff, people indeed caring for loved ones within the community who've now been isolated for a degree of time, and the need, I guess, for some targeted mental health services and support. The social capital, though, is a really interesting one. So the volunteering response, that absolutely marvellous outpouring of compassion and readiness of people to volunteer on a scale and in numbers that we've never experienced before, I think provides us with some fantastic opportunities to realise the resilient communities that we have and the value of both the voluntary sector, volunteers themselves, and the reality is that communities will continue to often provide the first level of local support and response to their own, you know, the people that they know within their local areas, their local geography. And of course, one of the great outcomes of this is the lessons we're learning maybe around what some of the newer foundations for resilience going beyond COVID are going to look like. Even, dare I say, looking again at legislation, looking at some of the roles, responsibilities, the way that a pandemic is organised and managed on a national, subnational and national level, are the kind of priorities that I think are certainly immediately obvious. But to repeat, by no means is this the end of that list. I'm sure there are more that you would add for yourself.
Thanks for that, David, for the introduction to recovery priorities. When we think about recovery, we think about it in two ways, about recovery and renewal. So when we're talking about recovery, we mean the LRF partners will collaborate to reinstate statutory services. They'll learn from COVID-19 and they'll prepare resilience. So it's very much about getting back to a state whereby resilience is assured. It's about relatively in the short term, looking at what these exposed priorities are from the events that have been happening and overcoming those exposures and trying to put in place the systems that you need in order to assure resilience. The pace of being able to do that will depend on ongoing demands. It will depend on the fatigue of the organisation, of the people. It will depend on your ability to get supplies in. But it's all about these short-term transactional activities to help organisations to recover and put them back in a place where they can prepare for the next emergency. So in contrast, renewal is this much more ambitious, longer term activity that is going to be taken by some areas. The first task to do is start to appreciate what's happened. So what's happened during COVID? How have the people, how the processes, how have the place changed as a result of this? And to start to understand that and understand it in quite some depth. And then on the back of that, to identify, well, what do we want to change to? What renewal do we want to have happen? And design some fast and slow actions that might need to be done to achieve that new vision. So here, renewal is very ambitious, it's very complex, it's social, it's incredibly strategic, and it's broad-based across a whole range of different parts of the area. So whether it's the democratic aspects, whether it's the geographic aspects, but it's all about developmental, it's about transformation. So whereas recovery is about transactions, renewal is about transforming our area through developing a whole series of multiple broader partnerships and being able to develop this ambitious change programme through that new activity. In thinking about what the task is then for our LRFs, it's about thinking about three activities, at least three, simultaneously running: response, recovery and renewal. And this graph tries to illustrate what that means. So the red wiggly line is looking at the actual number of cases from COVID. And at the peak, we're obviously got response running, and so you can see the red line at the bottom, but we've also started to think about recovery. And we're starting to make decisions in response that make sense for recovery. So we've got response and recovery running in parallel at those points. But very much as we're moving beyond the peak, we're starting to think about some of these big challenges, some of these big opportunities that we can see are opening up to us. And so we're also starting to run the planning of renewal simultaneously. And these will continue running, response and recovery, running in parallel, including as new waves come in, including as ongoing planning and execution of renewal happens. It's not as simple as that, of course, because In the background, we're also thinking about issues like Brexit. We're thinking about issues like the global economic situations that will be going on. So if we thought that response was a significant challenge, and it was, then recovery and renewal may be even more challenging because of the parallel activities that are going to be running, and because of the far-reaching nature of this. It's going to be equally as complex. It will be obviously more protracted, and what we've learned in the last few weeks and months is it's going to be incredibly political and will require a lot of partnership working from the very beginning. What we're going to do now is to take you through a step-by-step guide that helps to understand what is it that you need to do around recovery. So this slide is very much based on the Cabinet Office slide, but we've updated it for COVID and tried to make it relevant to the issues that you're facing at the moment. In the red box, the common aims are around establishing common aims for the RCG, making sure all the people are aligned and working together around a shared perspective. The grey box looks at starting to think about recovery actions and this idea of a renewal and thinking about a renewal summit. The blue box is about beginning to involve people. It's about looking at what the impacts are of COVID, but involving others to understand what their experiences have been in contributing to the impact assessment. The green box is about project tools to identify and deliver and to report on the issues that you need to do as part of recovery. And then moving into debriefing and learning lessons. And then the yellow box is very much about strategic aims. It's about the aims for recovery and renewal. It's about identifying these large activities that you're wanting to do and making sure that leaders and organisations are aligned as far as is possible, and then beginning to commission action, to monitor that action, and to ensure that the vision that's been created earlier is actually being delivered. So to explain this step-by-step guide in a little bit more detail, the first task is thinking about how do you set up the RCG. And here it's about, if you have the LRF RCG set up, then are you going to have multiple RCGs sitting below that at the local level? If you are, then how will they share information across themselves, perhaps through the LRF's RCG, or how will they feed information up and receive information down from the LRF? It's also about looking at the triggers and the thresholds. So moving between response and recovery, as might happen during COVID, as new outbreaks happen and as other challenges come into play, then how are you going to move between those different response and recovery activities? Who's going to take those decisions? And what are going to be the thresholds that you're going to operate by? And then it's looking as to who are the leads for this and who is the membership within the RCG, looking at a whole range of different organisations, involving them to ensure that their aims and objectives and their shared ambitions are fully integrated into the RCG. David, do you want to take over the grey boxes?
Yes, okay. So in the grey boxes, we'll talk to you about two very basic concepts. One is about the toolkit we call a renewal summit. This is about considering those ambitions that you will have locally to exploit the opportunities for wide-scale renewal and change on the back of the COVID experiences, but also at the same time, there'll be some functional activities that we believe will be slightly easier to achieve. So reinstating services, putting things back into a state of readiness for the next wave or the next emergency indeed. Business continuity, statutory functions, resilience arrangements, dismantling some of the response infrastructure as would be appropriate at that time. Again, we've spoken to you about commissioning impact assessments. We'll talk to you again in the slides that are coming up about exactly what that means, what that might look like, and a suggested methodology that we'll share with you, and identifying unmet needs, but also how you can involve affected communities, the businesses, stakeholders, and in particular, given the importance of recovery and renewal, the elected members. Okay, debriefing, pausing to learn the lessons and apply those lessons, of course, is equally important. And then we'll talk you through some project management tools to make sure you deliver some of the activities, the actions that you've all agreed on. And we'll talk again about how to report that activity upwards to government and indeed receive support and information from government subnational levels.
We're going to finish off going through the step-by-step guide by looking at recovery strategies, by taking some of the work from the impact assessments and seeing how that can be created into a strategy for recovery and renewal. We'll be looking at some areas of responsibility, looking at who is going to actually implement these actions, and specifically thinking about commissioning out these actions for delivery, monitoring them, and ensuring that they align with the vision that's been created early on. Okay, so recovery works best when you think about the different aspects of your local area. And here we've been thinking about it in terms of people, place, and processes, and looking at local areas and thinking about how have the people been affected? How are our decisions going to affect the people? What support needs to be put in place for those people? And how do we know when that support is needed? And doing that not just for people, but also for place and for processes, because COVID's had effect across all of these things. But we're also very aware that these are influenced by, they're moderated by the amount of power that they have and the partnerships that are there. So the amount of activity that you can actually do will depend on how much power you've got and will depend on how you can exercise that power, what partnerships you've got set up, and how you can draw those partnerships into this activity so that the best decisions are made and the best support is provided in the most timely fashion. In terms of some of these partnerships and who actually has power in this situation, we have been thinking about it in terms of 5 groups of people. And we start off at national government level. So national government lead on the transition timelines. They'll be looking at transition from response into recovery. That will be a local issue as well, but it'll be very much setting economic recovery and policy changes. And so a key stakeholder there that we need to think about when we're developing recovery and renewal plans. The region and the local partnerships are there. We can think about how local government sits in that. So whether it's the Local Resilience Forum, whether it's the local economic partnerships, the LEP, sustainability and transformation partnerships, health and wellbeing boards, it's really understanding what are the partnerships that will make recovery and renewal possible, and how strong are those partnerships, and where do we need to make them even stronger and involve them. One of the partners, a very key partner, will be the local community. That local community during response has been self-organising. It's been supporting vulnerable people, supporting itself. It's been volunteering in ways that we've never seen before. And so the local community as a collective has a significant influence in this context and can be a tremendous partner for delivering recovery and renewal. But so too can individual organisations. Organisations in your supply chain, organisations in your partner collective that are really adding value through the operations and service delivery that they offer you. But all of that organised effort, we need to think about people. We need to think about these individuals who are sitting at home, who are able to influence, who are being subject to COVID and the restrictions that are being placed upon them. And they are having to both recover themselves, but also they'll be a key voice in terms of informing your recovery and renewal approaches. So in terms of them recovering themselves, things like mental health, financial futures, but then the responsibility will become on other parts of this pyramid in terms of thinking about who's going to provide that support. So will the support come from organisations, communities, partnerships, or will it be provided nationally? So let's move on to see enough about the basics of recovery is to look at how recovery can be set up through an RCG.
The slide you're seeing in front of you is a suggested table for an RCG, its first meeting, its membership, and then we'll unpick some of the roles. Very deliberately, we've placed at the top of the table, those you know, there is no hierarchy within the world of SCG and RCG. This is just to illustrate the importance, I guess, of those partners at the top end, if you like, the north end of the table, having a welfare or local service delivery role. So very much led by local authorities for reasons I'll explain in the next slide, but they're adult services, they're children's services, social services, volunteer organisations, public health, which of course is now a local authority duty, along with, of course, colleagues from the NHS and the wider commissioning groups, and then indeed the other representatives from the tiers of local authority within kind of unitary, twin tiers, the upper tiers, lower tiers, etc. And then at the bottom, of course, the underpinning supporting organisations, including the police, emergency services, fire rescue, transport providers, media and comms, and of course the important role given the coordination at national, subnational and local levels of housing, communities, local government, and the RED team, the Resilience Emergencies Division. The role of an RCG, clearly agree its membership, make sure you've got the right people around the table, identify a chair. Now, traditionally, I think local authorities quite rightly are seen as being best placed due to their statutory welfare functions. We've discussed some of them, including public protection, of course, economy, volunteering, and most importantly, given what Duncan was just talking to you about, the democratic lead for, in particular, people in place, I think is incredibly important. You, of course, may decide that for administration functions, it's better that somebody else chairs and allows local authority the thinking time to look at the way decisions are made. It's not important. It very much is about how you operate locally. It's just about saying that the membership is key and identifying an effective chair, I think, is the outcome you should be looking for. One of its first roles, of course, is going to be commissioning impact assessments, because you can't plan for recovery until you've gained a good understanding of what the effects, impacts and opportunities have been. You'll clearly want to agree areas of responsibility, the scope for different partners coming together or indeed acting individually, some parameters you might want to set on the degree to which people will work together or indeed individually. And there may be some areas of responsibility around particular sector recovery options. You hopefully will want to establish links with broader strategic partnerships that Duncan's already referred to. We're talking about the wider health wellbeing boards, we're talking about the local economic partnerships, we're talking about other pre-existing broader coalitions who have already maybe done some thinking around the next 10 years within the locality that may now indeed have been affected itself by the COVID experience. So reaching out to create those links to make sure that everything can be complementary, we think is incredibly important. Of course, one of the main roles for the RCG is to formulate an actual recovery strategy, to commission the collective activities, and as we've talked about before, to monitor and actually make sure those actions are achieved, delivered, and that the LRF can be accountable for what it's been able to achieve. And then, of course, the important function of actual resourcing recovery, which, of course, remains a strategic role for each of the Category 1, Category 2 responders, including people, human resources, and, of course, the important issue of discussing how to finance recovery within the ambition and the objectives that you will set as a collective working group. Communications in recovery are as important as it would have been in response, so we would expect that the SCG comm cell will probably morph towards the RCG and support it, because there are some important messages, no doubt public messages, that you're going to want to share about what you're trying to achieve, and indeed let people know how they can be a part of or indeed influence some of the strategies that you'll want to set. Clearly, communications, as you'll all know, during response is difficult. During recovery, it becomes more complex, and certainly we think should still be coordinated. And then, of course, there's the internal, external comms, the information sharing, the central reporting, upwards and downwards between national, subnational levels. So to very much categorise it, the multi-agency group coordinating all media comms issues during response will probably look something similar during recovery. Engaging affected communities in the recovery process, be that by consultation, public messaging, surveys indeed, or even requiring representation for some of the way that you might assess the impacts and then understand what to do with them. Protocols for engaging elected members, and of course one of the most important functions within guidance for recovery is making recommendations to elected members for renewal opportunities, be they economic development, societal opportunities, or indeed healthy living, well-being. And then that functional stuff at the bottom of it all, the multi-agency information management, the recovery reporting framework, establishing a common understanding of what's going on at national and local levels, and the kind of support that you might require from subnational levels and national levels. Okay, guidance is fairly clear on establishing structures to help coordinate and deliver recovery at both national, subnational, and local levels. I won't go through the slide in detail. It is based on current guidance, and it establishes clear roles for both HMG, Her Majesty's Government, legal government departments, right the way down to local levels, and provides a suggested mechanism by which coordination across RCGs on a more regional level might be managed by MHCLG. But I'll explain that in a little bit more detail in the next slide. One of the most important things to do really as an LRF is to agree how recovery across the different local authority boundaries within the Resilience Forum will actually be coordinated to avoid confusion. Most of you will know that LRFs are not similar. You know, there are many different versions, especially when you look at the boundaries. They're all based predominantly on police force boundaries, of course, but within those boundaries, there'll often be a mixture of what we call metropolitan, so larger areas like Greater Manchester, the West Midlands, up into West Yorkshire and London, of course, but also additional complex tiers of local government. So you'll have some counties which have very simple two-tier mechanisms, but you'll have a number of LRS where there are actually multiple counties, unitary, district, urban, rural combinations. So Thames Valley, for example, is a great example. 2 different county councils and a good mixture of both unitary and district combinations as well. So the guidance is quite clear. It doesn't dictate exactly how the RCG should be established, but it does suggest that confusion should be avoided at all costs. And there are 2, it appears to us, very simple mechanisms that you can choose to operate. One is a single RCG across an LRF level, so one recovery coordination group serving across all local authorities with agreement, or indeed you can actually establish separate RCGs in each of, I would suggest, the upper tier unitary or county council local authority areas. So both models are permitted under guidance, certainly. I think the key thing is to decide where there is an added value, if you like, for more than one local authority to come together. Now, that can either be because of pure efficiencies, the fact that most of the activities are common or have a commonality to them, therefore would require a degree of coordination, or indeed looking at from an affected community point of view, it would just provide consistency of the experience for the communities who are engaged in, subjected to some of the recovery activities under the auspices of the LRF, or indeed the RCG under different local authority structures.
So one of the first activities to do is to set up an RCG. Before setting up the RCG, it's important just to take some time to pause and to appreciate what's actually happened, to talk to people, to negotiate, and to set up an RCG that you think can help you to deliver the ambition for renewal that you have. That means taking into account the structures, taking into account the partnerships that you need, and understanding how this has had an effect on the people, the processes, and the place, so that when you start developing your renewal strategies, then it takes all of these things into account. One way of starting to develop your renewal strategy is to think about holding a local renewal summit. And this is an activity that brings together a group of people, the local stakeholders, to achieve positive direction for change. As we talked about earlier, this is about significant change, not the small transactional activities, but large, ambitious, transformational work that helps to work across a whole range of different partnerships, a whole range of different relationships, in order to deliver more significant change, something aligning with the SDGs from the UN and that sort of ambition that they communicate. However, the Renewal Summit will be enabled by a whole range of different facilitators, like Optimism, an environment where ambition can grow and can blossom. It's about looking and understanding all of that in the context of regeneration of economic and health outcomes of society. And so a very clear focus on those, but recognising that there are some moderators to that ambition, that you'll be running 5 tracks of activity simultaneously: response, recovery, renewal, as we've discussed, but also the Brexit will start coming in, and the global financial challenges will might start to come to the fore. It's also about thinking in the summit about what are the good practices that are out there, and there's lots of good practices. HMG recovery guidance is there, and be inspired by that. Bring together people so that they can have thoughtful, provoking conversations and encouraging and facilitating dialogue to happen in those summits, so that people can leave feeling as though they have aired their views, they've been interpreted and incorporated into this shared strategy, this shared vision that they've got for how to renew their people, their place and their processes.
Okay, what does the mechanism look like? We think there are some very simple inputs into the beginning of the summit. It would make great sense for a briefing to be given to participants on what the key issues, the key learning from, for resilience, have been from COVID. So the effects on the economy, health, society, what might recovery and renewal look like for people, place and process, and has COVID and how has COVID reinforced local inequalities? A very simple agenda. I mean, clearly the agenda could be changed to meet your own local requirements or preferences, but here we just lay out what we think might work as a good basic agenda. So let's debrief what's happened to people, place, processes during the response phase. Let's talk about those pre-existing development strategies, the longer-term visions that were previously established, set out and agreed, the desired scale for ambition. Now let's just review them in the context of what we've learned more recently from COVID. And again, that issue about, is it reinforcing? Has it reinforced local inequalities? Does it change our view? Do we have a better understanding of how those inequalities are now impacting on certain parts of our communities? An organising framework to conceptualise some of the issues in the summit. Her Majesty's guidance, the response recovery guidance gives some great structure around terms they use, such as humanitarian assistance, economic infrastructure and environmental elements. We think that's a very good process, but you may have your own within the city, within the region, within the county, within the LRF footprint. That also has its own approach to ongoing wider term strategies. Or of course, you could look at the UN Sustainable Development Goals as per the diagram that we've included in all of these slides, just as a way of expanding out some of the opportunities that you might want to exploit through the summit. The key bit, of course, is agreeing which bits of these need to be done by working together with communities. And of course, we've now discovered some fantastic new, much more effective ways of engaging with affected communities, but also what you should be doing together, either through existing activities or through a new, if you like, business as usual for individual organisations. 3 very clear outputs though, which I think is incredibly important. It is about that piece that Duncan's introduced you to. It's about vision, it's about ambition for something different on the back of this fairly horrible experience. But it's also about then agreeing the recommendations to elected politicians, local influencers on some of those regeneration and development opportunities, because don't forget, it's a democratic process. And then that agreeing of common actions, looking for additional funding sources where required, or indeed by working together, maybe exploring some of the ongoing efficiencies, either by new ways of working or simply sharing it across coordinated activities.
Here, what we're trying to do is to understand what have been the impacts of COVID on our communities. So it's looking not just at the social effects, but what have been the economic and the health effects, and really trying to understand from the ground what has been going on, what have been the effects, and so that plans can be put in place to begin to address those effects. It's about working out which sectors, which services, which communities and individuals have been affected most by COVID, and how has it impacted them, and to what extent has it impacted them. So what we outline here is the National Recovery Guidance approach for impact assessments. We've clustered it into 4 different activities, each activity with a number of points underneath. But first, it's about setting up the impact assessment. It's about trying to clarify what is the purpose of this assessment, what is the level of granularity that we want to go into in this assessment, and where are we going to consult and collect information to try and find out about what's been happening at the very local level. It's about putting a time frame around that assessment so that people who are filling in the assessment know what is expected of them and how to complete it, and giving them guidance around the type of assessments that they need to make. So giving them information about the sorts of judgments that you're asking them to make on the impacts that they have identified. Then it's about moving into collecting that information, so actually issuing the impact assessments and asking people to identify how their populations, how their assets, how their activities have been affected by COVID, and the whole range of impacts that you can see that have been taking place in the community. It's about assessing those impacts, about measuring the extent of that loss, the extent of the impact on the people. And then the last section is about calculating the economic loss of that. Calculating economic loss so that you can start thinking about, well, where do we need to put additional financing into correcting some of those losses that we've experienced. But here it's about understanding the financial effects of that, support mechanisms that can be put into place, and identifying what local reinvestment strategies could potentially help to reverse some of the effects and begin to address some of those challenges that are now being felt very acutely at the local level. So going back to the very beginning of this process, setting up the impact assessments and then collecting information for assessment, what do you collect that information on? And we've got a slide that tries to explain that from the perspective of the guidance again. So government guidance would suggest that we have 4 main topics that we consider in terms of recovery: humanitarian assistance, economic, infrastructure, environment. To this we add communication and governance and legislation because they've been so affected by COVID. What we don't want to do is suggest that these are the only topics, or indeed that these are the best topics. You need to make a local decision, knowing what the issues have been during COVID and identifying a range of different topics that provide you with focus, and a focus that covers all the issues that you want to address during the impact assessments. Based on these 6 topics that we've got, what are you going to ask about the topics? And here we provide a series of questions that you might want to think about. So the first question is, what are the significant consequences that COVID's had on your area of work? And asking that of the people that you're going to commission to provide you with some responses. You might want them to go a little bit more detailed to think about what the impact has been of that, thinking about whether that's been a limited impact, a moderate or severe, with the idea that if it's a severe impact, then that might be somewhere that you want to put more attention, or attention in the short term rather than in the longer term. Or it might be the questions at the bottom of the slide might be more appropriate to you in terms of, okay, so what have been the effects of COVID in the short term, and starting to put quite some focus on, well, what are these recovery actions that we need to implement, or looking more towards the renewal aspects of impacts and opportunities through some of these transformational activities that you could do over a longer period of time. So you've got all of these comments coming in, all of these consequences coming in from the people who you've commissioned. And how do you deal with 800 or 1,000 consequences? You need to group them in some way to make sense. And again, you can use these 6 clusters or the 38 subtopics or whatever structure you want to make sense of these. You're not trying to deal with 1,000 consequences. You're now dealing with a smaller number of topics. So that can help you to start thinking about, well, what are the strategies that we need to put in place to deal with the consequences that have been shared with us during the impact assessment? what we can do then is group these consequences into what we call action areas. These are areas where you might want to put some recovery actions, some renewal strategies around to begin to address the impacts of COVID. To undertake the impact assessment, need to think across all of the effects that COVID has had, the social effects, the economic and the health effects, but also think about the impacts that there's been on different sectors, on different services, on communities, and how it's been felt by individuals. And here we can start thinking about what has been the baseline. So what was the pre-COVID condition? So in the case of volunteers, we can consider the relationships that they've had with the voluntary sector, the way in which volunteers have come into the organisation, and the typical way in which you've engaged with volunteers. The effect of COVID-19 has been that some of the voluntary sector staff have been furloughed and that they have had trouble in fundraising, which has really made the sector even more fragile than it was. The impact of that has been that you could potentially commission, or you could potentially ignore that struggle. So by commission, we mean you could start commissioning out the activities that you provide, some of the support to the shielded people, support to vulnerable people. You could pay the voluntary sector to be able to deliver that for you. Alternatively, you could ignore that and not take a close interest in what's actually happening to the sector. And I know that most local authorities are doing the former. They're taking a very keen interest and putting money back into the VCS, but you still have those options. But then thinking about what the actions are, some of the actions could be very transactional. They could be an immediate recovery activity that you could do. For example, you could provide small grants to the voluntary sector organisations in order to get them through the next few weeks. Or you could take a much more transformational approach to this, looking at it as a portfolio of strategic renewal action. So for example, for the voluntary sector, you could embed this into a programme of community resilience. You could commission the sector and bring them much closer towards the local authority and towards the emergency and crisis response that the local authority provides. You could integrate mutual aid groups into that community resilience response, and you could bring in business volunteers, organisations that want to come and provide donations of materials, of time, of money, and really integrate all of these different sources together to take a strategic renewal action towards your community resilience endeavour. So each approach would be perfectly legitimate, but you do have different alternatives of transactional right through to much more ambitious transformational action.
Well, what do we do with that knowledge? What do we do with our greater level of understanding, our assessment of the effects, impacts and opportunities? And the process, I guess, is now about moving into determining what recovery strategies are going to look like immediately, into the medium term, and then off into the longer term. Okay, so let's talk about implementing recovery strategies. There are two aspects to it. One is having an overall recovery plan. Something that shares the purpose, the scope, the areas of responsibility that we spoke about at the beginning of the presentation. A documented process to set your recovery strategies across the partnership, the agreement for shared aims and objectives, the actions, the activities that Duncan's introduced you to deliver some of the shared outcomes, and the project delivery approach that you will want to take, be that program management or a different way of governing the actions to ensure that they're met, that the activities are delivered within a timely fashion. And then that separate piece about determining what the ambition for the longer term piece of renewal, the transformational stuff that you can do together as a partnership. Just introducing you on the right hand side of this slide towards what we would commonly call shared aims and objectives, common shared objectives for the partnership work to agree upon. We think there are 6 potential categories. As with all of this, this is not exhaustive. You clearly may add or detract from this list, but we think there are some very clear objectives that ought to be shared around functional recovery, the restoration of statutory services, functions, the ability to learn lessons from the event itself and then apply them into future planning. And of course, that whole piece about assuring the partnership that it is ready to actually deal either with a concurrent event or the future emergencies. The needs-based recovery for us very much dependent upon the outcomes from your impact assessments, but certainly objectives of how you're going to translate that into activities on the ground to address the wider consequences of COVID. The recovery action plans themselves, again, how are you going to achieve that? Some specific objectives about who does what, where, and how. We think there should be some objectives set around effective communication, be that in recovery reporting nationally, because clearly recovery is likely to be coordinated at a national, subnational, and local level. The ongoing consultation, hopefully you will be having, and the wider engagement with stakeholders, local elected members, for example, community groups, and other affected individuals. Hopefully you'll set an objective that's based upon the ambition for renewal, those transformational pieces we've spoken at length about now. And finally, but by no means least important, your plans towards exiting recovery, because at some point, clearly, this will need to move from where we are now into either a business's new usual or indeed the future within the resilience field that you occupy. So the ongoing outbreak management maybe by this point can be managed within normal services without the need to coordinate or indeed supplement those services. Business as usual, or business as the new usual, is settling down. You've learnt the lessons you've set out to learn and you know how to apply them. And indeed, you've taken part in any national, subnational, local reviews of the COVID response and recovery overview. What we're going to do now is just share with you a little bit more detail on all 6 of those particular themes for strategic objectives. I'm not going to read through them all. I'm going to let you scan them with your own eyes and take them in as you see fit. So 3 slides will follow that covers these in just a little bit more detail.
Okay, so to try and bring together everything that we've been talking about in this session, we've been talking about this need to think about recovery as reinstating, learning and preparing for the next emergency. And these are transactional activities. But then you can move into these more transformational activities of renewal. And renewal needs to be done in a fast and a slow way. But you're going to end up probably commissioning out an awful lot of this activity to the people who know, to the people who've experienced, the people on the ground. And they will be able to provide you with the opportunity to reflect, to analyse, and to think about what's actually been going on and what is it that you want to renew, what this new world is that you want to start moving towards as a partnership, getting people involved, bringing in the community, and taking a very clear project management approach to begin to develop strategies and plans that sit around that so that you can begin to develop that vision that you have together. Again, just to reiterate this step-by-step guide that we've got, what we've done is take you through each of these blocks of activity and try to bring them alive in terms of what might be an approach that you could take to address each of these tasks that you're facing at the moment. We wish you well in this endeavour. So I think it's just left to say thank you very much. If you want to get in touch, our details are there. Good luck with your recovery and renewal planning. Please do get in touch. Let us know how things are going. We've got involved in a number of RCGs, very keen to find out what people are doing, especially around the renewal piece, which we see as having a tremendous opportunity created by the very, very difficult and horrible situation that we find ourselves in through COVID.
Thank you, Duncan. I agree with everything you said. Good luck, everybody. Thank you for listening.